Have you ever had that feeling, that heartburn that just will not quit? Or that sensation when you swallow that something isn't quite right and no antacid even touches it? Well, today we're going to dive into a condition that gets mistaken for simple reflux all the time, but it's way more complex. We're talking about eosinophilic esophagitis, or EOE. For so many people, the whole journey starts with this one nagging question. You feel that pain in your chest, that burning, but you've tried all the usual stuff and nothing's working. And you can't help but wonder, what if this is something more? And that right there, that's the absolute heart of the matter. The problem isn't what most people think it is. This isn't some kind of plumbing issue with stomach acid splashing up. No, this is actually your body's own immune system launching an allergic attack right inside your esophagus. Kind of wild, right? So let's break down what's really going on. So, what does this actually feel like? I mean, for a lot of people, getting a diagnosis only happens after this long, frustrating road of dealing with symptoms that just will not go away. So while some of these look like other conditions, the real telltale sign is often the trouble swallowing solid food. That's called dysphagia. And this can escalate to something genuinely scary called a food impaction. We're talking about food getting physically lodged in your throat. It's so severe, it's actually one of the main reasons people with undiagnosed EOE wind up in the emergency room. Okay, so we know the symptoms. Now, what exactly is the condition that's causing all this trouble? Let's pull back the curtain and unmask the real culprit here. So what is EOE really? Let's put it simply. Your esophagus should have zero eosinophils in it. None. These are a type of white blood cell that are supposed to fight off certain infections, or they show up during allergic reactions. But in EOE, they basically invade the esophagus and set up shop, causing all this chronic inflammation. The biggest takeaway here? This is an immune system problem, not an acid problem. And this is so important because it perfectly shows the difference between EOE and what it's so often mistaken for, GERD. With EOE, the cause is an allergic reaction driven by eosinophils. With GERD, it's just stomach acid. And that's exactly why typical GERD treatments like acid blockers or PPIs just don't work for people with EOE. They're trying to fix the wrong problem. So, we've got the what. The next big question is why? Why on earth does your immune system suddenly decide the esophagus is a target and needs to be attacked? Okay, think of your immune system as a super sensitive security system. First, a trigger shows up. Maybe it's a piece of food, maybe it's pollen. That trigger trips an alarm, activating a gene called TSLP. This alarm then sends out these chemical signals or cytokines, things like IL-5 and IL-13. And these signals are basically a bat signal calling all eosinophils to rush to the esophagus. And once they get there, they cause all that inflammation and scarring that makes it so hard to swallow. So yeah, it's not just one single thing. It's really more like a perfect storm of factors coming together. Genetics plays a huge role. This thing definitely runs in families. Then you throw in triggers from the food we eat and the air we breathe, all interacting with your own unique immune system. And when we look at who gets EOE, a pretty striking pattern emerges. It is far, far more common in men. Specifically, Caucasian and non-Hispanic white men are diagnosed at a much higher rate than women from the same background. And get this, while it can show up at any time, the average age someone gets diagnosed is 34. It often hits men in their 20s and 30s, right in the prime of their lives. So if all the signs are pointing to EOE, how do doctors go from just a suspicion to being 100% sure? Well, the path to diagnosis is actually a very specific and clear-cut process.
It all starts when those really stubborn symptoms just don't get better, even after you've been on high-dose acid-blocking medicine for a couple of months. That is a massive red flag. So the next step is an upper endoscopy, where a gastroenterologist puts a tiny camera down to take a direct look. But just looking isn't enough. They have to take little tissue samples, called biopsies, from a few different spots.
And this is what they're looking for. But the final, definitive proof, the smoking gun, comes from that biopsy sample under the microscope, and it all comes down to this number, 15. A pathologist has to count 15 or more eosinophils in one tiny, high-powered field of view. That specific count is the gold standard. That's what confirms without a doubt that it's EOE.
Okay, so you have a diagnosis. What now? Well, the good news is there's a really clear three-pronged game plan for treatment that lets you take control and manage this thing really effectively.
The whole objective is incredibly simple and direct. Get the eosinophils out of the esophagus. If you can do that, you bring down the inflammation. And if you reduce the inflammation, you get the symptoms under control. Every single treatment is aimed at that one goal. Pillar number 1 is diet. Since food is often the main trigger, one of the best strategies is to avoid the usual suspects. This is called the 6-food elimination diet, and it means cutting out the top 6 foods that cause most of these reactions. Then, after things calm down, you can slowly add foods back, one by one, to figure out exactly what your personal trigger is. It's like being a detective for your own body. Pillar 2 is medication. Now listen up, because this is important. These are not the kind of steroids you inhale for asthma. These are topical steroids that you actually swallow. They're made to coat the lining of the esophagus and fight the inflammation right there at the source, without having big effects on the rest of your body. And the third pillar, this is for cases where the inflammation has already caused some physical changes, like scarring or narrowing, which are called strictures. If that happens, a doctor can perform a dilation. It's a procedure where they gently stretch the esophagus during an endoscopy to open things back up and make swallowing much easier. So here's the bottom line. Is EOE a chronic condition that you have to live with? Yes. But is it manageable? 100% absolutely. With the right mix of diet, medication, and sometimes procedures, you can get real, lasting control over your symptoms and your life. And that leaves us with a pretty fascinating final thought, doesn't it? A condition like EOE is such a powerful reminder of just how deeply our immune system and our digestive system are connected. It really makes you wonder, what else is there to learn from this surprising, powerful connection? Thanks for joining us for this explainer.